Welcome to our guide on taking care of your clear aligners. We'll explore how to wear your aligners, what foods to avoid and enjoy, how to brush and floss with aligners, remote monitoring using the grin scope, and ensuring your aligners journey is smooth and successful. Aligners need to be worn full-time, meaning 22 hours a day. You should only take your aligners out to eat, drink anything other than water, and when you are brushing your teeth. Each aligner tray should be worn for 7 days unless prescribed otherwise. If you miss days or are not wearing your aligners full-time, pick up where you left off and wear that tray for an additional 7 days. If you lose or break an aligner, send us a grin scan and message about it immediately. We will instruct you on how best to continue with your treatment. Now let's talk about how to properly remove and insert your aligners. Each aligner will be labeled with the tray number. Make sure you have the correct tray. To remove aligners, go from the tongue side of your teeth and pop off the back molars on each side. Then gently lift off your front teeth. When inserting your aligners, line the tray up with your front teeth first and push down. Seat the rest of the tray by sliding towards the back and pushing the tray onto your molars. While inserted, the aligner needs to be seated all the way down, meaning no gaps between the tray and your teeth. Try using a chewy to seat the tray all the way. When you are not wearing your aligners, you should be storing them in a case which we will provide to you. Our motto is from mouth to case, from case to mouth. An aligner should never be stored in a paper towel, napkin, or pocket that will be sat on, lost, or even thrown away. There are no food restrictions when it comes to clear aligners, and you can eat whatever you like as long as you remove your aligners prior to eating. Be sure to brush your teeth after every meal as to not trap food in between your teeth and the aligner when you put them back in. You can leave your aligners in if you are drinking cold or room temperature water, but must remove them for drinking anything else as it will stain, melt, or deform your aligners. Chewing gum is not allowed with aligners in because it will pull the aligners off of your teeth. Smoking is also not advised with aligners because it stains your aligners and your teeth. To clean your aligners, use a toothbrush and toothpaste. Make sure to brush and floss your teeth as well before inserting your aligners, which you can do how you normally would. You can deep clean your aligners using Effordent, Retainer Bright, or an ultrasonic pod a couple of times a week. You just soak them in cold water with the product for 15 minutes. Aligners should not be placed in hot or boiling water as the aligner will become deformed or melt. White spots can form if plaque sits on your teeth too long. This is called decalcification, and it is caused by the bacteria in the plaque breaking down the enamel of your teeth. You can prevent this by rinsing your mouth after eating and brushing regularly to keep your smile bright and healthy. Our office monitors your treatment progress remotely using the Grin app. This means you can reduce in-office visits by sending monthly scans which replace 4-week in-office checkups. This also helps us catch and address any issues promptly, reducing your overall treatment time. Remember, broken or missing trays can delay your treatment time. If you have a broken or missing tray, button, or attachment, send us a grin scan and mark it urgent. You can also send us a message and we will respond to you as soon as we can. We might not be able to repair the broken button or attachment if we aren't aware of it before your next appointment, so be sure to let us know about it as soon as you can. At some point during your treatment, you may get elastic bands. Be sure to wear them 24 hours a day and change them out at mealtimes to ensure the elastics are applying force to move your teeth. The more you wear them, the less time you will be in them. At the end of your treatment, you will get your thermoformed removable retainers. Discomfort after switching trays is normal because your teeth are not used to moving, and it should resolve within a day or two. Try taking over-the-counter pain medication like Tylenol or ibuprofen to alleviate discomfort. Cold foods and drinks will help relieve the pressure of the aligners as well. If you have a rough or poking spot, dry the spot off and stick wax on it. Eventually, your cheeks will callus and it will not bother you anymore. If you are sore, you can always try chewing on a rubber tube called a chewy. This will help circulate blood flow to your teeth and speed up the recovery process. Thank you for watching. We hope these tips help you care for your clear aligners. Remember, we're here to support you every step of the way. Keep smiling and enjoy your aligners journey.